So now we talked about Disney. Let's talk about Mercy a little bit. What do you like about Mercy? What would you tell your friends and family to say that if they were having a health or medical issue, why you might recommend Mercy?
I recommend Mercy because first, the doctors are top notch. Every doctor I've had is amazing. I always feel confident about the treatment plans. They always answer any questions and they listen to me. If I say I don't want a certain thing, they understand and they don't push it, which I think is a very important characteristic. And it makes me feel confident that they're listening to me. The other thing is the nurses. The nurses have become my family, especially in outpatient chemo. I see them every 3 weeks. I was seeing them weekly for a little bit. They've become my family. I know them. I know some of them live on a farm and others have other dogs. And it's just, they've become my family. And I would recommend anyone to come to Mercy just because of that. And they have a really good port infection rate, which is really important. I know a lot of people who've had their ports infected, and I haven't heard of one at Mercy since I've been here. So it's just a great hospital, and I would recommend it to everyone.
Now, for viewers who don't know, when you mentioned the port, can you tell us about what that actually is?
Yeah, it's in my chest. Well, you can't see because I have a sweater on, but it allows all of my treatments to go through without messing up my veins. I got it when I was first diagnosed, and I would recommend anyone who's going through cancer treatments to get one because it really is a lifesaver.
Now, you mentioned earlier about the issue of costs and so forth, and I know you do some work in terms on the fundraising side. Tell us about your efforts there, trying to get the word out and getting the coverage that you need.
Yeah, I hold an annual dance concert. This year it's in June. It's usually in January because that's when the theater was available, but this year it's in June. It's actually on National Cancer Survivorship Day. And it's just a day of my friends travel from all over the country. Really, I have someone coming in from Arizona this year to perform and raise money. And I sell merchandise with my bald ballerina logo on it. And we have raffles and silent auction. It's just a day of people from my life pre-diagnosis to now. It's a lot of people from my childhood perform. And this will actually be my last performance in my concert because I'm just getting too old and my treatment has worn my body down too much. So it's very special. I get to perform with some of my best friends, and it's my biggest way of fundraising for the year, and it really helps cover my insurance if I need to travel anywhere for treatment or if it's a trial, I just have it in case I need something. So it really helps cover all of those medical bills that are never ending.
Now, you mentioned it very briefly. It's the first time it's come up in the interview, the bald ballerina. What's the story of that?
I started bald ballerina shortly after my diagnosis. A professor in college, he had taught us how to blog to promote ourselves as a dancer, and he suggested I do something to just keep track of my story. I didn't have to share it, but as soon as I started it, it was initially just for my immediate family and my close friends to keep track. And then I was like, you know what, why am I keeping my story quiet? I'm going to just let it go. So I posted a big thing and it just took off from there. And that's where I do the most of my advocacy, and I share every time I come into Mercy for a treatment. And it's just people who follow along with my story. And some people have been with me from the very beginning and others are brand new.
Have you been contacted by a lot of other folks who are dealing with breast cancer and developed any relationships with them?
Yeah, a few. A lot of times people will reach out because I do share what drugs I'm on because I think it's important for people who might be starting it or not sure. Whenever someone is starting a certain drug, they'll reach out to me, especially if I'm on it currently. Others just ask my opinion on stuff, and I always tell them to trust their gut. It's very important to trust your gut. And if you're not confident with what the doctor is recommending, it's always okay to get a second opinion. I got a second opinion here and I don't regret it at all. And some of them have become good friends and some of them haven't, but I do hear from them from time to time. And it's just, we're a very small community, but also a very large community. It's very strange.
No, it is something that I think the general public really isn't aware of. When they think about breast cancer, they think, well, that's something that's way down the road if it's going to be an issue at all, and I'm not going to worry about it now, and don't really think about it. You had mentioned that because of where you are now in life, that you're not really performing so much anymore, but you teach, correct?
I teach weekly at a local dance studio. It's a studio that actually has been part of my dance life for a very long time. I used to do Nutcracker. My old studio and that studio used to do Nutcracker together. So I teach once a week with them, and it's nice because I do sometimes share my story and educate them, because I think it's important as young women and boys, I do have a boy in one of my classes, that they know that they can take charge of their health and they can tell the doctor if they want a test or something. So I always try to educate them once a year or so about what I'm going through, so that they know if something comes up to speak up and to share what's happening with their parents or with me or whoever.
There's so much information out there nowadays. I mean, people go online and they're like, well, if I take this supplement, and you probably get messages from people, you should be on this, or you should be trying, this supplement, or eating this food, whatever. Is there been any information that is that you found to be legitimate in terms of like what you do and what you take in terms of your diet and whatnot?
A lot of it is being more plant-based. My cancer is hormone-driven, so I try to eliminate things with extra hormones like cheese or meat. So I do eat a little bit of cheese here and there, and I do eat fish, but I try not to eat meat as much. And cutting sugar or having natural sugars, but that's really about it.
We hear a lot about the Mediterranean diet, for example, and that's kind of plant-based.
Yeah, it's plant-based with like a fish or something, but there's so many different diets, and one year it'll be this one and one year it'll be this one. So I eat what I want, but still be healthy about it.
Well, you certainly have a very positive attitude, and talking to physicians, they've told me many times that how a patient decides to address their problem, if they come to it from a negative point of view versus a positive point of view, certainly with the positive point of view, they've actually seen that patients do better, excel. Would you say that's true in your case?
I 100% believe it. There's a woman, she's 21 years living with metastatic breast cancer. She was diagnosed when her child was, I think, a newborn. And she is so positive. She radiates light and joy whenever you talk to her. Even if it's just on a phone call, you can feel her positive. So I think it's positivity and being happy. And even if you're mentally not happy, but you laugh and you have a support animal that makes you smile, I think it is a big part of your treatment. And it's so important that I think some people don't realize that they need to try to find the positive in a negative situation.
Mm-hmm. You mentioned you support animal, but there's support humans as well. In fact, we recently did a story with one of the breast cancer surgeons talking about the importance of having a strong support system in your life for your recovery. Can you tell us a little bit about your personal support system?
My support system is definitely my family. When I was diagnosed, they all rallied, from my cousins. I've gotten really close with my cousins, my aunts, the whole family came together when I was diagnosed, and they are still with me. If I ever need anything, they're ready to help. Or if I have a question or want a recommendation for something, everyone's willing to jump in and help me. I also have a few metastatic friends. I try not to have too many metastatic friends because, of course, sadly, I've lost some. But they are really my support system when it comes to just complaining about cancer, the cancer world, or whatever. They're always there for me, and I can always call them up, and they call me up when they're having issues, and we just rant. And I think it's important to have those people there who understand what you're going through and are there for you when you need them.
Maggie, thank you for your time and your candor. I'm hoping our viewers enjoyed this chance to hear your story, learned a thing or two, maybe that they can apply to their daily lives.
Thank you.
And thank you for watching. On behalf of myself, our guests, the Mercy staff, and the Sisters of Mercy, we wish you good health and humor. And until we gather again, may the road rise up to meet you. So you lasted through the credits for Wait, Doctor, I Forgot to Ask. This is where we briefly discuss those hand on the doorknob questions posed by patients at the end of their visit. A little different this time because we're talking to a patient. So Maggie, from your perspective, what's the important questions perhaps a patient who is fearful of a cancer diagnosis, should ask their doctor on their next visit?
I don't know. It's very personal because every cancer story and journey is very different, but I would definitely ask if there's a question that you think is dumb, ask it. Whether it's, what are the side effects? How long is it working? Will I have diarrhea? Like, don't be embarrassed about any question because that's why they're there, is to answer those questions. I mean, I had my cousin who survived leukemia. She came with me my first chemo and she was asking all the questions because she knew what to ask. And if you have someone like that, bring them with you. If you have someone who's gone through a cancer diagnosis or something like that and they've lived through it, bring it, because they bring that whole different perspective and they're through the other end of the tunnel. So have someone, if you can, have someone like that with you. And have someone there who might not think of it, but they will. When you get those words, you have cancer, there's like a fog. You can't think. You're so overwhelmed. So if you can have someone there or a couple people there to ask those questions for you, have them. It's your right to have them in the room with you, so do it. And if you think of a question, write it down before you go in.
Yes, I was going to say, if you can do a little bit of homework, ahead of time, because as you say, once you're actually there, and this doesn't really matter whether you're having, certainly with a cancer diagnosis, but anytime, if you're going to the doctor and maybe it's something you're particularly concerned about, to think about this a little bit, because you're right. I mean, when you're actually in front of the doctor, it can be an emotional experience, and your brain can kind of just seize up. And that's why we invented Wait, Doctor, I Forgot to Ask, because you get there and you're rushed in, you see the doctor and they're talking, and next thing you know, you're in your car and you're driving home like, oh, I can't believe I didn't ask them about this issue, or I asked her about this issue. So, that's why we do it. And your point is very well taken. Some of the other physicians that we've talked to have said, yes, if you can bring someone along with you, it can make a big difference.
And there's also my chart. I use my chart. Sometimes I forget to ask something, or like if I need something, I forget when I'm in the room with them. So message through my chart. Dr. Iceberg is great about responding, and his PAs. So, and I'm sure most Mercy doctors are, because they're the best. So use my chart. If you have a really pressing question, use my chart. It's a very helpful tool when you're not in the room with the doctor.
Thank you, Maggie.
Mm-hmm.